Thank you very much for inviting Ines to join this event. So we will speak a little bit about emergency deinstitutionalization. Together with my colleague, the Deputy Director of Ines, Ines Bulic. Next slide, please. Okay, why does we need to intervene urgently for the moment? First of all, we have the United Nations Convention on the Right of Persons with Disability, the Article 11, who is really special on the situation of risk and humanitarian emergency, that oblige that all the state parts should take all the necessary measures to ensure the protection and safety of persons with disability in all kinds of situations of risk, including situation of armed conflict, humanitarian emergency, and occurrence of natural disaster, which is the case for the moment. So in some disaster situation, people are really required to evacuate. So that's for us now the moment for persons who are really inside the institution. It's really time for them to get evacuated. And then we have another argument that we can use, and that are the Sustainable Development Goals, who really said that we really need to leave no one behind. Because as the Agenda 2030 stipulates, it's a political commitment that all the governments who are members of the United Nations, they really commit themselves to build a better future for all people, including millions who are currently denied the chance to lead a decent life, dignified and rewarding lives, and to achieve their full human potential. And the second thing is also that they need to succeed in ending the poverty, reduce inequality, and surviving the planet from ecological degradation and climatic change. Next slide, please. So how does the SDGs support the Convention on the Right of Persons with Disabilities? So for the moment, the SDGs are a political framework, while the CRPD is really legally binding document that guide all the governments on how they could also achieve the SDGs for disabled persons. So one come to enforce the other. And similarly, as the CRPD, the SDGs have to be integrated in laws and policies, and they also need to provide the decent budget that are needed. So while the CRPDs really focus on disability-specific issues, the SDGs are mainstreaming the human rights of persons with disability through all the areas. So when we speak about access, it's really very broad. So actors of the SDGs is not just like the disability movement. So it's for all the stakeholders. All people working on this area are supposed really to realize also the rights of persons with disability. So the Agenda 2030 commits in the same spirit as the CRPD to empower those at risk of vulnerability, including disabled people. So it also promotes universal respect of the human rights, equality, and non-discrimination, something that all persons with disability are very often submit to. So how does, the next slide, please. So what is the basis for deinstitutionalization? We have Article 19 of the CRPD, where we really stipulate that living independently and being included in the community is one obvious right for all persons with disability. And we have the General Comment 5, who really give guidelines to all the member states on how they could realize this. So within the General Comment 5, they have obligation to fulfill. And one of this obligation is to include shortly the implementation of structural reform. Includes, in fact, the implementation of structural reform, and that is to improve the accessibility, to raise awareness among all persons with disability, to realize the institutionalization. And also, one other point is really important, it includes also the closure of institution of any size and the elimination of the institutionalization regulation, along with establishing of individualized support services like personal assistance, and also individualized plans for the transition with budget and time frames, as well as inclusive support services to realize this. Also, one of the obligations on the General Comment 5 is a coordinated cross-government approach, which really ensures the reforms, budget, and appropriated changes of attitude at all levels and sectors of the government. Another point is the availability of sufficient number of accessible and affordable housing units is crucial to realize the institutionalization, including housing for families. So not only small apartments or small houses, but big ones where people can stay within their families. And so housing must not be made conditionally upon requirement that reduce the autonomy and the independence of person with disability. It should be the inverse. And also, a structural plan must take deliberate and immediate steps to reallocate funding towards realization, the rise of independent living. And the last point that we want to highlight is also entail the introduction of inclusive education. Okay, next slide, please. So another basis of the strategy, DI strategy, is it must contain specific timeframes and adequate budget. It must really say from now till then we will realize this and we will have this budget to realize it. It must also aim to eliminate all form of isolation, segregation, and institutionalization of persons with disabilities. And special attention must be paid to persons with psychosocial and or intellectual disability and children with disability, so that they are not excluded from those DI strategies. It also requires participation of persons with disability personally and through their representative organizations in their design and implementation. And it also requires establishment of a mechanism to monitor this implementation. Has it done be right? Does things need to change? Things need to be adapted? And so, especially now, what's the impact on, so the next slide, under the COVID-19 situation? We see there is a lot of unequal access to COVID-19 testing, owing to the lack of accessibility of testing sites and health facilities. Another thing is that the information on COVID-19 is often not available in all formats accessible to persons with disabilities. And it's not only about format, it's also sometimes too late when they realize it. And also the full impact of the pandemic on persons with disabilities remains really unknown. Why? To the lack of disaggregated data. And it's also preventing the design of an evidence-based policies. And so initiatives to address these issues have been put in place in very, very few countries. And also the pandemic will increase other health risks for disabled people as lockdown and social distancing measures pose challenging in obtaining health services and assistance in regular manner. So emergency evidence suggests that disabled people in institutional settings are experiencing the highest rate of infection and mortality from COVID-19. My colleague Ines will highlight a little bit more. So what is the impact on the COVID-19? We see that really, this is really showing more the pre-existing inequalities and discrimination, and is also aggravating the multidisciplinary challenges faced by disabled people in access to health care and essential services, access to education, employment, and also participation into community. I will hand over to Ines now.
Yeah, thank you, Nadia. So I will speak a little bit about emergency deinstitutionalization. So we, as Nadia said, we knew institutions were not good places for disabled people. We knew that they discriminate, segregate, violate disabled people's rights. So we knew that even before the pandemic. But as the pandemic started, that was in Europe, that was in February, March, we started seeing a lot of evidence about fatalities in care homes for adults, for older people, for children. So here are just some of the headlines from the time. So coronavirus, inside story of Spain's care home tragedy. Belgium faces a reckoning for its care home strategy. From the UK, almost 30,000 excess care home deaths. And this is all from June, July. So next slide, please. And so while we did not have data about all the countries in terms of how many people died in institutions for disabled people and for older people, there was a piece of research done in June by the London School of Economics and some other groups, which showed the extent of fatalities in care homes. So we have just picked some numbers here. So, and these are of June, as of June 2020. So there have been many more since then, but not any more, research or confirmed evidence. So, for example, from Belgium, we know that as of June, 50% of all the COVID deaths were in institutions. So almost 5,000 people died by then. In Canada, 85% of all COVID deaths were in institutions. So over 6,000 people died in institutions. In France, 49% of people were care home residents. And that it was out of a total 30,000 deaths, over 14,000 were institutions. In Germany, 39% of all deaths were in institutions, and in Spain, 68.1% of all COVID deaths were in institutions. So really, there were very high fatalities in institutions for disabled people, for older people all around Europe. There was a lot of media coverage as well. So we started discussing what to do about it. And please go to the next slide. So together with colleagues from Disability Rights International, where Dragana is from, and the Validity Foundation, we started having discussions about what we could recommend, what we could propose as the way forward. As I said, we know institutions have always been bad, but there was a clear case for acting now. Usually governments say deinstitutionalization is a long process, it's a complex process, it takes years to implement, but we just felt there was no time to wait. Also, we know that people, disabled people who live in the community, there were much fewer fatalities and much lower infection rates, simply because people were able to better protect themselves. They had control over who supports them. They could stay at home. They were seeing fewer people. So they had much better control over their lives, rather than people in institutions who were stuck in the same rooms, in the same facilities with, sometimes hundreds of other people, with staff coming in and going. And we know that COVID was brought into institutions by the staff, and there was no way for people to protect themselves, which is why the fatalities were so high. So we held an event on the 11th of June together with colleagues, and we invited the then Special Rapporteur Catalina de Bandas and the chair of the CRPD committee, Damami Basharu, and we defined emergency deinstitutionalization as protecting disabled people's basic right to live in the community, getting them the support required to leave the institution in the short term, and then subsequently providing any additional support and access to mainstream society. The aim would be to achieve the transition as fast as possible, while of course preventing homelessness, people being left without any support and having to also rely only on their families. So while the institutionalization as such involves many different segments, including raising awareness of the society, including all the accessibility of the mainstream society, for emergency deinstitutionalization, we defined some, a smaller set of steps. So if you go to the next slides, as a result, or maybe not as a result of the event we had, but certainly maybe inspired by it, or could be as a result, there was a working group established by the CRPD committee during its latest session in August, September, a working group on deinstitutionalization, recognizing the horrendous impact of COVID in institutions and the need to get the governments to act now and fast. So this working group was established. The group is now in the process of defining its terms of reference and the program of work and how it will engage with the other stakeholders. So as far as we understand, there will be an opportunity, of course, for civil society to engage with this working group. And we are also waiting to understand, what that will look like and what exactly the working group will do. So as Enel and with colleagues, we're waiting to get involved in that. And it would be good, of course, if other groups like the Korean Forum and anyone else got involved in the work of the group as well and provided input. In terms of the evidence of emergency DI, we of course tried to look for some, but there is no real evidence yet. There are some cases where people were sent from institutions back to their families. So families had to pick up all the, responsibility of care. There is some. There was some evidence from the area of homelessness, where people were provided with some alternative housing so as to be able to leave homeless shelters, which were also, places of high infection rates. So there is no real evidence of proper emergency deinstitutionalization where people would be sent home and or provided with housing and provided with quick extra support. The caring responsibilities were left to families, basically, for people who left institutions, and of course that didn't work very well in some cases. So the next slide, please. So just to sum up what we see, what we think it needs to happen is basically people should be provided with alternative housing where they do not have to be together with other people. Or if they have housing to go back to, any adaptations should quickly be made to make that housing accessible for them. People should be provided with personal assistance or other forms of individualized support instead of their families having to take up caring responsibilities. People should be provided with peer support because, of course, moving people around, can be traumatic for some people. People need to adjust quickly, and this role can be taken up by DPOs or other community groups able to support these people. And of course, people should be provided with some funding to be able to live in the community. So these are the immediate steps that would need to happen for people to be able to move out of institutions into the community. Of course, for some people, it is easier to do that, and it should be done. So whoever can move more quickly should be moved more quickly. Then efforts should be made to move others as well. But our main point is that this should be done immediately. And the next slide, please. Then once that happens, of course, the government should continue putting in place other necessary preconditions for independent living. So while emergency deinstitutionalization is needed now, other steps should be taken, other measures should be taken to ensure people can really live independently in the community with proper support. And this includes, of course, access to appropriate and accessible information, a fully accessible transport system, of course, adequate provision of personal assistance, proper housing, adequate income, an adequate provision of technical aids and equipment, full access to the environment, access to inclusive education and training, and appropriate and accessible health and social care provisions. So I will stop here. This is in terms of emergency DI. I will hand over to Nadia back again to tell us very quickly about some of the next steps that should be taken as required by the Sustainable Development Goals.
Okay, so the next slide, please. So the next steps, in fact, there's a whole list of recommendations realized by the stakeholder group of persons with disability to government, to healthcare providers, service providers, and the communities. Another point is to really now realize the compliance with the CRPD and the SDGs. And then also we need to build capacity for the collection, analysis, and dissemination of disability data to enable a comprehensive assessment on the progress on the situation of disabled person vis-à-vis the SDGs and the CRPD. Another point is also that the inclusion of persons with disability as both not only as beneficiary but also as agents of change and experts in the COVID-19 response, recovery, and building back better. So the next slide, please. So we need also to address health, economic, and social system through a twin track approach of inclusion. Sometimes we need specialized support, sometimes also mainstream services need to be made accessible for the conclusion and targeting a specific needs for disabled people and members of other marginalized groups. Another point is also to ensure the access to quality basic services for disabled people and end the legal, social, and institutional discrimination faced by disabled people, including those facing intersection and multidisciplinary forms of discrimination. So it's up now really to government to discharge and release persons with disability from institution and promptly ensure provision on support in sustainable cities and communities through family and informal networks if it's needed, and fund inclusive support services. Even if they are public or private, both of them need to be supported and funded. And also to recover better by adopting and reinforcing plan, supporting deinstitutionalization for inclusive, affordable housing, because that's the biggest problem people face, transport, accessible transport, public and private services, including the health services, to guarantee that if there is a second phase, they also have access to it, and also to guarantee a decent income, access to inclusive education and long life terms, and all the other parts of the pillar of independent living. Well, thank you for your attention. If you have any questions, we are here to answer them.